There have been a lot of dentists who have taken sleep introduction courses. And when we do the analysis, we find that a very high percentage of them either never get involved at any length in sleep or even treat sleep. And certainly that doesn't make any sense because we know of the great dental need. We know of the dental need to both screen patients and move them into sleep medicine, and of the large number of CPAP non-compliant patients or the patients that are appropriate for first-line treatment that therefore don't get treatment. There are lots of reasons for this. The number one reason is that there are many challenges that face dentists in terms of success of therapy, in terms of medical billing, in terms of moving patients into sleep medicine and understanding the limitations as well as the tremendous potential, and putting that in some perspective, in some way to make that all work. It can't happen in an introduction course. It's a new field. Taking an introduction to sleep course is like taking an introduction to headache course. You don't become a neurologist with one course. We've made this recognition. Dental Writer has made this realization. And in order to help you succeed, in order to help you move to a level where you can treat people, larger numbers, comfortably, without fear of failure, understanding to a greater degree the potential side effects and putting them into some perspective, understanding exactly how to deal with your staff and have them part of this team, understanding billing and truly how to get reimbursed appropriately for well done and well documented services. That's the purpose of the advanced course. The advanced course is to move you from where you were in an introduction course to a point where you can fully implement with confidence and with ease. It takes us to the next level. It takes us from the basics of AHI, RDI, sleep apnea versus hypopnea versus upper airway resistance syndrome, and it moves us into an area that allows us to take that information, apply it realistically, and implement dental sleep medicine on a regular basis in our offices. Literature is reviewed, current concepts are reviewed, some of the basic concepts we learned get focused into a greater sense of reality. Cases are reviewed, and we look very seriously at some of the unlikely, though sometimes present, comorbidity issues in terms of joint dysfunction and muscle dysfunction. We take a very hard and special look at bruxism, a disorder, a movement disorder of sleep, potentially related to sleep apnea, and how we as general dentists can not only deal with apnea, but should look at bruxism carefully and how we can control the forces that threaten our patient as well as the dentistry we provide them. It's a tall order, and we're ready to give it to you.